Thank you very much. I hope you're not sleepy yet. I think you all had a great lunch. I'll try to keep it simple and very focused to what we believe in actually as a company. I'm based in Singapore. I go back and forth. I live actually in the Bay Area. And when Lee asked me to talk, I was not sure what to say because I don't have a medical background actually. So I come from a completely commercial, technical background, but nothing in medicine whatsoever. But an incident happened in my family about 10 years ago where one of our family members passed away because of one very simple thing. They could not get access to good data. So they went to the doctor, and the doctor told them, well, you're fine, don't worry about it, go home. And someone mentioned to them to get an ECG done, and they couldn't get an access to the ECG over the weekend. And the person actually passed away over the weekend. And after I heard the story, I figured if it happened in my family, it probably happens in many other families. So I took a journey and said, let's refocus our efforts, which were in consumer products. I've done a lot of stuff in the internet space, and then go back to what we believe is important for us. So I started with the heart. And why I started with the heart, my grandmother once told me that if a plant is dying, you have two choices. You actually pour more water, or you don't do anything. So the question is, circulation becomes a key to what we do in life, and that's your blood circulation. And as individuals, the heart is probably the most important function for us, whether you're healthy or not, you need it. And all the data you read about the heart is very demographic. So for example, they might be able to tell me that someone like me would die in a zip code 95070, but they won't know whether I'll die or not. So there's a lot of what I call big data, but not individualized data on the heart. So I started focusing on tools, technologies for monitoring, for non-invasive way of helping the heart get better. And that became the focus of our company. So Renew Group, based in Singapore, has multiple divisions, but one of them is focused just on technologies related to the heart, all non-invasive, and then tools to provide researchers great amount of individual data at a very, very, very low cost. And I emphasize that word, very low cost, so they can actually do the great research they're doing. So when we started, our goals were very simple. Come up with lower costs and better patient outcomes. We all want that. But then what we found when we did our research was great professionals. Everybody wants to help. But what you lack is infrastructure, actionable data. Everyone with Fitbit, Jawbone, they've done a great job of getting people to encouraging them to walk more, sleep better, so on and so forth. But a lot of that is not actionable data. It's not clinically valid, actually. And the third point I bring to the table is the fact that they're disengaged patients. So once you don't have actionable data, the patient actually gets disengaged because they have no way of knowing whether they're good, bad, going the right way or the wrong way. It's just something keeps beating in their system, which is the heart, and they feel that everything is working. Now, to get started, the first thing we focused on, how do you establish a baseline? So we started looking at the wellness paradigm. And after I talked to Lee about a year ago, he said, well, at a minimum, if you've got to establish what the baseline for every individual is, what does your heart say about you, actually? So to set up a neutral parameter is a complex beast, and we found that very quickly. And on the other hand, heart-related ailments are one of the largest costs in healthcare. Just staggering numbers. Just last year alone, $540 billion was spent in heart health, of which 30% was wasted because they didn't have good data, actually. So there's a significant amount of data which gets lost in translation, transactions, operational systems, which is actually making the cost even go higher. We all believe, and everybody knows this, that circulation is a key component to your system, to your heart, to your health. And yet, no one establishes a baseline for your heart. Why? Because it's either complex, and you can see that takes time. You have to take time away from work. Then you got to chase down some ECG guy, the echo guy, so on and so forth. So a lot of things happen along the way which actually make people very complacent about their heart health until it actually hits home or it happens to them. Now, if you look at this picture, I start with when your heart is not working well, you have impaired circulation, and then you go down the path, and it's just a spiral downhill. As you go down, I started doing research on why does this happen? I mean, why is it that people don't want to do a baseline? Well, the problem is very simple. And I'm sure you have all seen this, at least at my age, I've seen it a few times now. Measuring the heart is an institution-centric problem. So you take a bunch of electrodes, you take a bunch of monitors, you hang it around your chest, you walk around, it collects data, and then you send it back to the hospital, they do some analysis, and they come back with some information. Then the next step would be you do an echo. Same thing, you have to go to a clinic, you have no knowledge of how to do it yourself. So the customer really only wants to do this when something really bad happens. And in the middle, I put down why it's a big problem for both insurance companies, hospital systems, as well as clients. There's time lost, expensive, it's very complex, and then you get really bad compliance because if the top three are not addressed, most people don't want to do this. It's just a headache. So we focused on this and said, how do you take this and find analogies in the business where people have taken very complicated operational systems and turned them into something simple? And the blue says it all. Inaccurate, slow, and insufficient data leads to very poor and late diagnosis, and there are numerous studies about that which you can actually look at, and it's one of the largest health and cost in healthcare. We have seen results as bad as 50% of echo and ECGs read wrong by cardiologists at 6 o'clock in the evening versus 9 o'clock in the morning. Because when they're ready to go home, they skip most of the data. I just look at 2, 3 things, you'll be fine. But they have no idea who I am. So that one problem of the fact that there are so many transactions, the number of errors keep going up. So we took this model and said, how do you take this model and look at what has happened in the business today? And here was our, basically what I call our cloud. So if you went from a great analogy of a landline to a mobile phone, and it increased productivity, increased services, people started using them. You went from inside IT to cloud services. Amazon is a great example. They did something amazing where 60% of companies are using that service. The cost went down. You went from wired, sticking to your computers, to wireless Ethernet. You can walk anywhere and get your data. Digital cameras, all the photos, data, everything on the cloud. So what that did was significant increase in productivity and decrease the cost dramatically. That never happened in healthcare. It's starting to happen, but no one took the steps of putting it all together. So we went and said, the first thing we've tried to figure out is how do you take this system, which I call tethered, which is institution-centric, where you have to go someplace and untether it. So that was our first thing. So today, you can see what happens. You go to the hospital, they stick a bunch of electrodes. Believe it or not, 6 billion such sensors are actually sold in US alone. That's a big number. And does all what you want to do, and our soft system was, why don't we just cut the wires? So you take the wires out of the picture, you make people mobile, you increase the workflow, increase the productivity, and patients don't even have to go to the hospital. They could do it in their house if they had all the right tools and were empowered to use it. Once we did that and put that in place, so the first thing is you cut the wires. Once you cut the wires, it does 2 things. Nothing in the infrastructure changes. So it's like wireless Ethernet. Nothing changes your infrastructure, but you get the same set of operations, tools, what you are used to, nothing changes. Once we did that, the second step is, what are you really measuring? I'm sure you have seen a lot of examples of great technologies which are single lead ECGs. So there you stick it on your heart, costs about $100. There's AliveCore and a couple of companies which are making great products like that. They'll measure a few data for you, hand it off to your cell phone, and the cell phone then can transfer to the doctor. Where it becomes tricky is how do you make it actionable? What clinician or a cardiologist is willing to take that data and take actions on it? For that, they really need what we call multi-wave ECG and all these other parameters tied to it. So one of the first goals was, if you're going to untether a wireless solution and create a wireless solution, it has to do exactly what a wired solution did before. So for example, a landline, it never ran out of a battery. Quality was always good. You could pick up the phone and call people. Cell phones became ubiquitous because they actually could provide you that. Long battery life, quality is decent, and then you can call anytime, anywhere in the world. Just like a cell phone, what did they have to do? We put the same scheme in place. So as Nathan was mentioning, I ended up going and hunting for companies, built some technology, put it all in place, and we ended up actually creating this new ecosystem. We call it a very disruptive mechanism, and as Lars was pointing out, a lot of your body vitals can go to the cloud and be analyzed there. So everyone is doing point products. They will make a sensor, great technology. Someone will make a cloud solution. Someone makes EHR. Someone makes health record software. What we did was created a new ecosystem where we built the Echo device. This is completely portable, and I'll show you in a second what I mean. We built a complete medical patch. A good example of what we have done with a patch is, I'll just pass this on if someone wants to see it, is right here. And it's fully functional and available in the market. We then created a whole database of storing images, ECG data, and various kind of medical data. So each individual who either has a patch or an echo has a folder in that database. From that database, we can then send it to data analysis. So I acquired a bunch of companies, echo analysis companies, so we can actually look at your echo and with 99% accuracy, detect 9 out of the 10 normal cases, which means you focus on the abnormal. And then at the same time, make this all secure, HIPAA compliant, so medical practitioners, healthcare providers have access to the same data as the patient does. It took us about 3.5 years to get there, close to a lot of money. But it's all fully functional. We have it running in the market. We have actually some large demonstrations going on. But we know that we can do all of this. So we opened up a special section here called third-party devices. So the idea was, if someone comes with a great sensor, like Lars was mentioning, all these flexible PCBs and technologies, they can interface to our product, and we will do exactly what we do with our product to theirs, which is take the data, analyze it, work with them, and put it back in the database. Now, this can be used today to analyze patient records, patient information, diagnosis, disease-related issues, disease management. More importantly, it's available to outside entities for doing research also, because it's all secure. So I can anonymize everything in that database and allow you to take a look at whatever data you want. By doing this, not only do you bring the cost of healthcare down, you actually take the normal people and keep them out of the hospitals. One of the biggest costs in healthcare today is people entering the hospital. Once you enter, the hospital is now liable for any infection you get there. So they don't want you in the hospital, believe me. They want to kick you out as soon as they can. They've literally created outpatient divisions just for that, so you can actually get monitored outside the hospital. It's a very important fact to remember about, especially about US actually. At the same time, this has to be cost competitive, so it meets today's numbers and lower. It should be available to everywhere in the world, so it's all global in nature. And to do something like that, we had to invest money ourselves, build the products, and bring them to fruition. So I'm proud to say, from our company standpoint, and what our company did pretty amazing, is the cost of buying 5 electrodes from 3M for doing a basic Holter monitor is about $15. We have the same device in this package, runs for 5 days on the same 2 coin cell batteries for $5. So this can actually replace any Holter monitor in the market today and has all the features and functions you would need to monitor the heart. So the only way to do that is to put these pieces of the puzzle together, because you can do one individual thing, but you can never get to the right cost structure. So the idea was to take all the transactions and take them out of the system. So all the transactions we do now are actually done in software. Everybody who was involved before is still involved in the process, except the data is accurate, real-time, valid, and available when you want. And that was the breakthrough we wanted to come do, and that's where we came to. To break this down a little further, We have a complete data management platform. So this is all FDA approved. It's actually being used globally right now. About 35,000 doctors use it. It's HIPAA compliant, so it meets all the security guidelines of US as well as all regulatory bodies across the globe. And then the data can be geofenced. So if a hospital wants to use it, the data stays inside. If you wanted to put it in the public market, you can, but it's totally the choice of the person who deploys the system. It's all runs on the cloud, so there's no IT, no servers, none of that. What this did was took the cost of processing an echo, which just the paperwork is about $38. We brought it down to 75 cents. So today I can take an image from an echo, move it to the cloud, show it to the practitioner, bring the data back, all that within 75 cents. So you went suddenly from $30 to 75. Now, a lot of people ask me whether do cardiologists like it. Well, what it does really is make their life much easier, because what we are doing is we're not asking or not coming to the table and saying, we'll fix what you don't have. What we are saying is, if you're normal, we'll let you know ahead of time so you don't have to rush to the hospital. And that is a big breakthrough in what we have done for the hospital system. The second thing which I just displayed here is this patch right here. So you can see right there. These 4 electrodes it took about 5 years in the making. And what these 4 pieces of, I call them pellets, stuck here, replicate 7 wires hanging off your body, but they bring it all to that area. So what that allows you to do now is you just stick it on and you go about doing your day's work. It stores data automatically, and then we give you a small watch band in which it has a way to alert the doctor. It has all the different wireless technologies built into the band. We did not want to go with an existing smartphone because you're limited by what the smartphone does. So we created our own. It's not a smartphone. It's an ancillary object. It's like having a landline in your house or a fax line. So it has GSM, so you can do wireless, you can do Wi-Fi, you can do Bluetooth, you can do medical band Wi-Fi. But it does something very else which is that important. You go to the hospital today, you enter the emergency room, you will see 4 people come with a heart problem. They all get electrodes and they hang a bunch of monitors next to you. In our case, you can have up to 60 people in one room with those patches talking to one monitor. And it only alerts when there's a problem. So all this is FDA approved, FDA cleared. We'll commercially launch it in July this year. But the goal here was very simple. How do you take the current infrastructure, don't change it? Because you don't want to, people don't like change. Consumers don't like change. But what you want to do is make them more efficient and productive. So this is about a productivity increase, reducing the cost of hardware in the system, and how many times does an MRI machine get used or an ECG machine? Only when someone shows up at the hospital. The rest of the time it collects the dust. Our business model is very simple. The patch is free. You only pay for it when you use it. So with that disruption, suddenly what you start seeing is a larger deployment and more patient engagement, because they're not paying for something they're not using. The second thing we did was echo services. So we actually have come out and we'll be launching this at the end of this year. This device is going to be a handheld echocardiogram device. So for all the visual indication, all color. Goal there was very simple. You cannot ask doctors to pay $20,000, $30,000, $40,000 for these machines anymore. It's just not practical. So what we did was we aimed for the global market, and we said the device is only going to be $1,000, shipping and handling. You only pay when you use the device. So the idea is you can actually have and empower every general practitioner, every remote clinic with some of these devices. They connect wirelessly, so your data can actually go to a hub and spoke model where it goes to a hub, gets analyzed by a lot of doctors, but at the point of presence and point of care, the cost is extremely low. So you can do a lot of preventive work before you actually go to reactive mode. Once we got this done, we had to take one more step, and I promise this is the last one. We now had to come up with a way to take all the data we are collecting and actually analyze it. So we ended up working with Dr. Jim Seward, who actually wrote the book on echocardiography. And he has a unique, he calls them artificially intelligent. For legal reasons, I call them assistive reporting algorithms. But literally, if you look at the right side, which are the sample diseases, very common ones, We can actually do that all in software without a single doctor present. What the doctor has to do is look at what we provide them in terms of management discussion, our results, and they have to sign off on that. So we are not the signing authority. It's still the cardiologist or the general practitioner or your healthcare provider. But we provide everything you need to do to make sure that those 8 or 9 people who are considered not that critical in nature can be done automatically rather than going through these procedures all the time. And a couple of examples of why this works at a high level. I'm sure you've heard of, and I know this one very well, which is sepsis. I just learned this in the last 3-4 weeks. I did not know that sepsis actually is one of the largest costs in healthcare. 25% of the people who actually get infections from any surgery and they get sepsis, they occupy 25% of all ICU clinics in the United States, actually. It's the single largest cost after heart in managing a patient. And why? Because when you have sepsis, every hour that you delay in diagnosis costs the human being 8% increase that they will die, basically. So after 4 hours, they have 9 doctors working on you to fix the problem. One of the things we focused on, like I said, was cost. So in a lot of countries, people will die and they don't even know they have sepsis. So what our idea was to actually design this patch, which we have now successfully done. You stick the patch on, and we actually detect your vitals, and we can alert if there's a sepsis condition. So what that does is while your patient is being monitored outside the hospital, remotely or in a remote cardiac setting, we can actually indicate to the healthcare professional that something is wrong. So you can mobilize the right kind of services very quickly. At the same time, you can do all kinds of vitals monitoring, cardiac telemetry, which is a big one, and the last one is this pre-triage vitals, which is now people are talking about clinical trials, or if you have a patient on any kind of cancer therapy, they can be home and being monitored remotely. And you can do all this stuff today, except we can do it for 1/20th the cost. So you can actually empower more customers to do it, and that was the critical part. The more people who are on the system and you can monitor remotely, the lesser the cost in healthcare. I'll focus on the left side here. We have actually shown, and this is clinically proven now, and we have enough data to show, that the average cost reduction we are driving is 50 to 80% lower. Productivity loss, we reduce it by 80%. People really don't have to go to the hospital for doing an ECG. You stick a batch and you're done. You don't have to go anywhere. Compliance is 85%. So we actually did a test in one of the hospitals, and we gave the patches out. All our company employees in Singapore, they have their patches running all the time because they can do it. They just have fun. Okay, let me put it on and see my heart. So, but it's clinically actionable, which means if they see a problem, and we have actually had 2 people we sent to doctors and they are on medication because they didn't know their heart was bad. They're young people, 27, 28. Transactions, our goal was you cannot have that many transactions when someone is sick. You cannot have 4 people, 5 people, and transfer data back and forth. So our mantra simply is from body to cloud and back with no human being except the patient. So we can take the data, move it to the cloud, analyze it, show it to the practitioner, come back to the patient or the healthcare practitioner without any human beings involved in the process. And then the last point I wanted to make was that it's good for home, clinic, outpatient, or hospital use. So like all the stuff we have seen so far, great amount of research which is going on. What we were focused on is how do you take something very simple and empower enough patients so the research you folks are doing actually has tremendous amount of value. Because now you can actually monitor heart health and related parameters at a much lower cost, much easier, and a lot of it is going to be in the public domain anyway, so you'll feel free to use it actually. So our goal was, clinically accurate, secure data for each individual. That's critical for us. Has to be at an individual level, and that's why when Lee asked me to come, I said, great, because he's focused on personalization. It's at an individual level, and it's purpose-built. You don't want to build something which does 100 things. You want to make it for a specific purpose. That's how you reduce the cost. So our goal was to make the patch the lowest common denominator so anybody can use it. You just buy it, you could literally buy it on a shelf from, let's say, one of your local drugstores. And then when you use the service, your doctor enables it for you to use it, and that's how you actually get charged for it. Until that time, no cost to you. What that allows you to do is improve the outcomes, but at the same time, you lower the cost. In the middle is what I call the continuum. So all the people in the middle are still involved in the process. It's just that the number of transactions they're doing has been reduced dramatically. And the numbers are, obviously, I'm sure you've heard of these, but 2018, just by having consumers have clinical data go to the cloud, the numbers are just in US alone, $50 billion worth of savings. So these are dramatic numbers. But what really does is billions are saved globally to focus on research now. So you want to focus on things which are not being done at a technical level, and there's research to be needed, not stuff which is, happens all the time. From a status standpoint, where we are today, our platform is in use globally. Our interpretation algorithms are in use by insurance companies. Heart patch, we will launch this year in quarter Q3. It's in testing phases. Testing means it's FDA approved, but it's actually going through its commercial phase of how do you put it in the channel and so on and so forth. And the Echo device, which is the handheld device, will be available in Q4 of 2016. And capping the whole presentation, I just want to say what I heard from Sir David Lane, who was responsible for the P53 discovery and a good friend of Dr. Lee also. He said healthcare is not about fixing things, fixing cancer. It's actually delaying the onset of a chronic ailment. So when Lee says, I'll take you to 100 and after that you're on own, that I truly believe in actually. And I think Lee always uses this line, which is, it's better to have a system crash than a component failure. So that's me. Happy to answer any questions, but I live and breathe Singapore, but I come back and forth all the time. And thank you so much for listening. I appreciate it.
We have time for a few questions. Lee? What does the patch detect in sepsis? Is it
temperature, hydration, exactly, hydration, pulse width, and then we have software which sits and actually does all the analysis and sends the data to you. And it's real time. Yeah. And so the uniqueness here was not, this is going back to the cell phone. You won't use a cell phone if the battery lasted 1 hour. So this thing actually would run 5 days on 2 coin cell batteries. You stick it on yourself, you peel it off and throw it away. That was really the disruption in the market. It was not about, there are a lot of people doing this, by the way, just not us. But the question was, do you want to put 7 wires or just, that's really the key to the simplification actually. And then it has unique wireless technologies which allows it to coexist in a hospital environment with a lot of medical bands. So I don't know if you know, but if you go to a hospital, they typically tell you to shut your Bluetooth phone off, shut down your Wi-Fi, because they have some real issues in hospitals. But this thing has a special band which allows it to actually conflict-free work in a hospital environment in any wireless band actually. And that was a unique breakthrough. It's very tough to do it actually. So battery life, robustness, and the fact that I stick it on and let's say I forget my access point at home, what do? Well, you don't have to worry about it. It still stores the data. So when you get close to an access point, it will automatically transmit. And then we put this one small piece in the middle. I'm sure you have seen in Holter monitors when you have an incident, you just press it when you're not feeling, you're feeling uncomfortable. So we actually do the same thing. It records the incident and the timestamp, and when you send the data out, it knows exactly when you were not comfortable, basically. So, hi.
Yes. So what's the exact clinical indication for getting the patch, and what's the actual market you're targeting? Are these only secondary prevention patients after cardiac infarct, or is that broadly in the public domain?
So I think, so we have seen different use cases. We have seen use cases where people are doing Holter monitoring today. And in a Holter monitor business, the profit margins are very low actually. The reason being the equipment costs are fairly high, and then there's a lot of return issues and stuff like that. So one market is just the Holter monitor business. So what we do is we introduce a new product, nothing changed, same business, except people doing that business have a much higher profit margin. So that's one part of it. The second part, which I just realized in the last 3-4 months we've been working on, is a large set of hospital REITs, which are now working on providing what they call the hub and spoke model. So your hub is all the cardiac, and the spoke is where you put all your patients actually. So remote monitoring is a big one actually. And the reason they want to do it is once you're in the hospital, they want to monitor you. Before you get to the hospital, they want to monitor you. And if you complain you have a chest ache, you are definitely being monitored. So in all those cases, things like this make life much easier actually. And the last use case which I've seen, which is also pretty unique, is actually for athletes. One of the things they're looking at is the combination of this, the hole in the heart problem where you get a shunt of plaque going through. And the question is, why does it happen? So there is a lot of research behind, you can get early indications of that by putting ECG right on the chest when you're exercising actually. So this is not for daily use. It's not a Fitbit, it's none of those. It's really for clinically actionable, accurate data. And if your GP says you should get it, you get it. If you don't want it, you don't have to have it. In some countries, by the way, insurance companies are giving it for free actually, because they can make this as a baseline, and every year they can drop your premiums as your heart is remaining either healthy or not. Thank you very much.